point, then once the final recommendations are signed off on, they will be able to vaccinate. So what the federal government is doing so that we are prepared and ready to go on day one, we have identified 10 pre-positioned sites across the state of Missouri who will receive vaccine in between when the FDA approves the EUA and when the final recommendations from ACIP are made. After that, once the ACIP has made the recommendations and we have adequate vaccine supply, then other approved vaccine providers would be able to order the vaccine. Next slide, please. So as I mentioned, this is a phased approach. In August, CDC released their playbook that outlines the three phases of this vaccine campaign. For phase one, there is going to be a limited supply of doses, and these doses are going to be targeted at the reducing the morbidity and mortality of COVID-19 within Missouri while reducing the healthcare system stress. Phase two, once we have some more vaccine, we will be moving into protecting those at highest risk and securing critical infrastructure so that Missouri can continue to reopen. And then phase three is when we have enough vaccine to vaccinate the entire population of Missouri so that any and every Missourian who wants or needs a vaccine will be able to receive one. I'm going to go ahead and answer this question. It says, why is the Pfizer vaccine not going through ACIP review process, and why is Moderna vaccine not posed for immediate shipment after EUA approval? So Pfizer is going through ACIP review process, but has to be approved by FDA first. So the FDA will vote on it on December 10th. And this is a estimated timeline. They are hoping that ACIP will make their final recommendations by December 12th. But there's no point in having ACIP review their information if FDA is not going to approve the EUA. And then Moderna, we are working on having the vaccine allocated so that it can ship immediately, and I will get to that here in a little bit. Next slide, please. So these are the phases that we have submitted in our plan. We are prioritizing long-term care facility staff. Those does include skilled nursing facilities, residential care, assisted living facilities, and others. And then the next would be paid and unpaid patient-facing healthcare workers. We are discussing whether or not to remove that comorbidity piece. The reason why that was in there was in case that we had a limited number of doses, so we had to be able to further prioritize the vaccine. And then we move into, and there is a slight change to this. We have went ahead and reflected what the ACIP voted on Tuesday, where they included long-term care residents in phase 1A. And so that's why they are bumped up. And then phase 1B is when we get into high-risk individuals, 18 to 64, and then high-risk individuals, 65 and older. The reason why those two are broken out is because in the early planning assumptions that we have been given, we were told that there was a possibility that the EUA would only be approved for those 18 to 55. So that will need to be fixed, but that is why they are split out. And then we go into first responders, critical infrastructure with high risk, and then critical infrastructure without high risk. Our hope is by the time we get to phase 1B, we have enough vaccine where we can vaccinate phase 1B groups in parallel. So we'll be able to let the citizens of Missouri know that if you fall within one of these critical infrastructure, you'll be able to work with a local physician or pharmacy or local health department to receive a vaccine. And then phase 2 we get into populations at increased risk for a negative COVID-19 illness, including prisoners and those experiencing homelessness. And then phase 3 is general population, or any of those in phase 1 or phase 2 that did not receive the vaccine, whether that be that they were hesitant to receive it. And then Dr. Baskin, we do have the numbers of the vaccines on, I believe, a subsequent slide, so we will get to that. Next slide, please. And here they are. Okay, so as I mentioned, we are getting ready to ship the first doses of Pfizer as long as their EUA is approved on December 10th. We have to place the order with CDC by close of business tomorrow. And we are receiving 51,675 doses from Pfizer in the first week. That is going to the 10 pre-positioned sites. And then we also identified providers in the different regions that were not represented by the 10 pre-positioned sites to make sure that we allocated all 51,675 doses. So we are in the process of submitting those orders to CDC. They will be held in pending status until the EUA is approved. Once we have more Pfizer vaccine, and it is open to a wide variety of providers, Pfizer does have the ability to do next day delivery as long as the order is placed Sunday through Wednesday by 8:45 in the morning. And the Pfizer vaccine is actually coming directly from Pfizer. There is an ancillary kit supply with each different vaccine with needles and syringes, alcohol prep pads, bandages, and then Pfizer's has a diluent. So the ancillary kit supplies will come before the vaccine so that you guys are ready to go once you have the vaccine in hand. So the slides are not reflective of the correct timeline, and the reason for that is we were under the impression that Pfizer would only ship every other week. They do have the inventory capacity to ship weekly now. So the week of December 20th through the 26th, which would be week 2, we have an allocation of 63,375 doses of Pfizer. I do need to preface that with this can change slightly. And then 105,300 doses from Moderna. We will be placing our initial order for the Moderna vaccine next Friday, or by next Friday. So we will be working with the approved phase 1A providers to get those orders placed. So if you are interested in being a COVID-19 provider, but you have not submitted or started your enrollment process, it is absolutely critical that you do so as quickly as possible because we cannot allocate vaccine to you until you have been approved. And then the week of December 27th through the 31st, so week number 3, it is going to be 67,050 doses of Pfizer and then 46,400 doses of Moderna. And those could both ship as soon as December 29th. So we are getting just over 340,000 doses by the end of December. We do not know what our first quarter of 2021 is going to look like yet, so I don't want to speculate. And then there was a question about, it is a 2-shot series, and I believe Lana is going to touch on storage and handling as well as administration. So we'll wait for that question until we get to her part of the presentation. And then I will put in the chat once I'm done with my presentation where the vaccinator application link is. So the next question was, when the order is placed, does the state determine which vaccine type we will receive? So we are trying to be very deliberate on what type of vaccine goes to which provider. Again, this is something that Lena will touch on. I don't want to take too much away from her presentation, but the Pfizer vaccine has a different minimum dose order requirement and has a different cold chain requirement than the Moderna vaccine. So we are trying to pair up providers' capacity to store and vaccinate with the correct vaccine. So those large healthcare organizations that have the ability to vaccinate a large number of people within 10 days are likely going to get the Pfizer vaccine and only the Pfizer vaccine. So Moderna would be for more of those smaller rural healthcare centers and local public health agencies. But Lena will touch on that later. Any other questions? These are all great questions. Okay, next slide, please. Okay, so, and thank you, Lena. I'll put in the chat the link to the vaccine enrollment. So as we mentioned, we are focusing our distribution of the first round of vaccine for our phase 1 populations. This is where it varies slightly from what ACIP just approved. We are focusing on paid and unpaid people serving in healthcare settings who have the potential for direct or indirect exposure to patients or infectious materials. And the key part of this is that they are unable to work from home. CDC does want us to target those direct patient care, but it does allow for anyone that falls in that category to be prioritized with phase 1A. It also includes staff working in long-term care and skilled nursing facilities. That also includes assisted living and residential living facilities. And the only change to this is that ACIP voted to include long-term care residents in phase 1A. And does this include staff at testing sites and vaccination sites? If they fall under the definition of a healthcare worker, then they can be prioritized. And then, as I mentioned, the cold chain requirements, as well as facilities' ability to store and administer the minimum number of doses in a specific time frame, will be a limiting factor in if a facility can receive a certain COVID vaccine or not. So Pfizer's is 975 doses within 10 days, unless the facility has an ultra-low freezer. With that, CDC still wants to have the providers vaccinating within 10 days. They don't want a provider that has the capacity to store 60,000 doses in an ultra-low freezer, ordering up vaccine and storing for 6 months. So even though you have the capacity to store for 6 months, they are really pushing for the vaccine to be administered within 10 days. And then Moderna is 100 doses within 30 days. But again, what CDC is asking us to look at is your 10-day throughput. How many people can you vaccinate within 10 days? And our goal is for widespread availability across all of Missouri to protect all healthcare workers. And I think we had, okay, so do you know phase 1 includes home care workers, homemakers working in client homes, not an actual facility, but working at the client's house performing personal care services? So home health, and I'm not sure if home care falls under that, it is people, paid and unpaid people serving in healthcare settings. They did mention personal care. So if they have the potential for exposure and they cannot work from home, then you would want to include them in your numbers. There may be a possibility that facilities are not going to receive enough vaccine for your entire organization. So you may have to look at a decisional matrix for who you are going to prioritize within your own facility. We are looking at trying to provide a template so that it can be consistent across the state, but that might have to be something that is decided on, is how are you going to prioritize if you only can get 975 doses, but your facility has 3,000 people. So that is something that we will have to work through. And then why are some enrollments still pending review? And that is a good question. We opened enrollment up to everyone. And so some of the reasons why it could be pending is we only review a couple times a week just based on our schedule availability. It is a 3-person panel, so we have to make sure that we can all meet together. So if we typically do Monday and Wednesday or Tuesday and Thursday. So that could be a reason why. Also, if they are a phase 2 or 3 provider, we were leaving those in pending, but we are looking at our process a little bit and trying to change some of them to be a more streamlined process. So there are a couple of reasons why they would be pending. So we do review them, like I said, multiple times a week. And then I think that was, for those of us on the state line and facilities in Missouri, Kansas, can you clarify how to handle Missouri versus Kansas supplies? We administer to employees patients based on their work visit location or based on their state of residency? So we are not restricting providers to just vaccinating Missouri residents. And so if you have people that work for your facility that live in a different state and it's easier for you to vaccinate them at work, go ahead and do that. We want you to get your workers protected. And we are working to provide that information to Kansas, or whatever state they work on, with a secure data sharing agreement that we have worked through CDC. So yes, you should vaccinate your workers regardless of state residency. It would need to come out of your allotment, and we would not allow for transfer of vaccine from a Kansas facility to a Missouri facility. So the vaccinator application is actually through our immunization information system, or ShowMeVax. So it will not be emailed. It is a centralized location, and we get notifications when we have new enrollments to review. Healthcare worker, again, it's just paid and unpaid people serving in a healthcare setting who have the potential for direct or indirect exposure to patients or infectious materials. The Tiberius listing was pretty robust. They're anything from psychiatric care to pharmacy to inpatient. So it is, they just have to have exposure to, or potential exposure to patients or infectious materials. But again, there may be a need for you all to prioritize within your own organization because you may not get enough vaccine in round 1 to vaccinate your staff or your entire staff.
Jennifer, there was a question in there about rural hospitals receiving Moderna over Pfizer. Do you want to touch on that?
Yeah, sorry, I'm trying to.
I know the chats are coming in quick. You guys have a lot of great questions.
So is there a list of the approved 10 sites? Based on guidance we have received from our federal partners, we are not releasing the list of the 10 sites to the public because of national security concerns. Sorry, I'm trying to. Anyone that is going to be a vaccinator for the COVID-19 vaccine has to apply through the COVID-19 provider enrollment. Okay, I'm not going to be able to answer all these questions, so we're going to have to. Lisa, what would you like me to do?
Some of these questions I think may be answered to in upcoming slides. So how about we go through the slides and then we'll come back to some of the questions at the end.
What was the question about rural, though? I do want to touch on that.
Sure. Let me go back.
Sorry.
No, you're fine. Annette says, did I understand you say the rural hospital clinic or clinics would receive Moderna versus Pfizer?
So that's a limiting factor. So we're going to review when you enroll as a provider, there are questions about your capacity to store in an ultra-low freezer that can maintain -60 to -80 degrees Celsius, your capacity to store in a freezer that can maintain -20 degrees Celsius, and your capacity to store in a refrigerator that can maintain 2 to 8 degrees Celsius. Based on your answers to that, we will match to the best of our ability the vaccine that will be a best fit for you, for your organization. So we really do look at the questions that you guys are answering. So as best as your ability to answer those accurately will be key. Okay, so let's go to the next slide. Okay. So we are moving from planning to operations. There will be a state implementation team that has the external COVID-19 vaccine advisory committee within it. We stood that up to make sure that we had many partners at the table to help us work through these tough decisions that we are going to have to make in the coming weeks of how to prioritize these doses when we have limited amounts of vaccine. And so the state implementation team will then be made up of the state executive team that will be comprised of myself, a deputy COVID-19 vaccine person, and then we are working with a contractor to assist with logistics, communications, provider enrollment, and then patient resources. That is rounded up with the regional implementation team. There will be 9 regional implementation teams, and they are represented by the 9 Missouri Highway Patrol regions. Next slide, please. So the regional implementation team, like I said, is per region. It is made up of local and community partners and health partners. There will be a Bureau of Immunizations liaison so that if there is resources that we need to provide to each region, we can, or if regions have questions, we can filter them up to the state implementation team. And then there is one vaccination support team for each region, and that is composed of 5 people. Those are the ones that were out for requests for proposals, and those will close on December 10th. The purpose around the vaccine support team is to provide support to the region. They are not responsible for doing all mass vaccination clinics for a region. So it's more of, I'm a small facility in Southwest Missouri and I want to hold a drive-through clinic, but I don't have the staffing capacity to do so. I would reach out to the vaccination support team for Region D and say, hey, can you all send your team down here and assist with this drive-through clinic? That's the purpose around the regional vaccination support team. Next slide, please. So as of 5 p.m. on Friday, we had 95 individual providers enrolled in the program, or sites enrolled in the program, I'm sorry. We are trying to expand out our providers, and we want to include major health systems, large and small chain pharmacies, independent hospitals and physicians. Anyone that can vaccinate, we would like to be able to enroll them if they have the capacity to store and administer the minimum doses and the required time frame. So that way we can have wide availability of vaccine across the state, especially when we open it up for general population vaccination. Next slide, please. I will answer the question about where will the children fall, and that is due to the fact that the phase 3 clinical trial did not include children. So I know Pfizer's just recently was lowered down. The clinical trial started to include children 12 and older, but until there is safety data for a wide range of children, they will not be included in the vaccination program. And same for pregnant women. And then, is this me or Lana? I'm sorry.
We can turn it over to Lana.
Okay, thank you.
Mm-hmm.
Okay, to enroll as a vaccine provider, you simply go to the vaccine link and check the box that says enroll as a provider. It takes you to the COVID-19 vaccine enrollment screen, and you can go through the steps. We do highly suggest that you download the PDF that will walk you through the process. The first step of the process is if you are not using Show Me Vax, you never heard of Show Me Vax, you do need to sign up for an to put forth an MOA, mutual an agreement. Next slide. These were common enrollment issues that we are facing, and the reason why a lot of the enrollments either get rejected or put on the back burner. Make sure you are addressing your non-physician contact or primary contact. It's a coordinator for if the is a physician, then they should choose a physician contact. Make sure your chief executive officer or fiduciary officer, each enrollee has to complete everything that is listed. If you all miss something, then we cannot process the enrollment. Another item that is often missed is the physician signature agreement and the physician contact, or also the storage units. Each storage unit is important. Vaccine that's not stored correctly will not be effective. For this vaccine, it is very temperamental and temperatures are very friable. Vaccine for the Pfizer vaccine has to be kept at -70, and that can be held in the ultra low shipper or a negative or a low ultra low freezer. Once it's removed from that and put in a refrigerator, you have 5 days to use that vaccine. So we keep track of those storage units. We also have to have a digital data logger, which is a temperature that constantly records the vaccine temperature in your unit. That is a condition with both of these are conditions from the CDC and our federal partners. Make sure your physician signing the agreement has a license number and an NPI that we can add to the managed clinic staff. Your freezer unit. Each unit has to be its own unit. You can do a chest freezer for Moderna's vaccine. You can do a refrigerator, but it can't be a combination unit, no dorm unit, no bar units. It has to be a standalone unit. Let's see, did I miss anything?
Anna, if I can interject, there are a few questions related to this process.
Okay.
Some have submitted applications and haven't heard back yet. Some have been rejected and don't know what their next steps are. Can you just kind of go over that? I know it may be kind of case by case, but generally speaking.
Okay. If you have been rejected, look to see what rejected you. There is a comment section, and each of them have a comment of why you were rejected. If you can fix it, go in and fix it, and then resubmit the application. You do not have to redo the whole thing. What was the other one? Sorry. Do you have to?
Just those who haven't heard back yet. I know there's a process for approving.
Yeah, the process for approving, we go through, like Jennifer said, we go through applications every couple of days. Quite a few are pending. So I think there's like 200 or something in there. So it does take us a while to go through the applications. You can always check in to see where you're at in the process, I do believe, on Show Me Vax. We also are prioritizing phase 1 applications. So if you are a physician or a practitioner and you can vaccinate adults and you see adults and you're willing to vaccinate, then you're going to be pushed ahead of some maybe a physician or a place that only sees kids. Since the kids are not the priorities on this, we're really pushing the phase 1 applicants right now. Let's see. Why aren't we allowed to use a combo fridge and freezer for the Moderna vaccine? Combination refrigerators and freezers do not hold temperatures. These are very friable vaccines. Any excursion in temperature can inactivate the vaccine. And when it inactivates, you cannot tell the difference. It still looks like the same thing. So that's why the combination units are not allowed. For a hospital and the CEO is signing an agreement, do you have to have a physician sign the agreement? One of the questions, so that is a good question. And I think we have a slide on that. If I do believe we do, but let me check. And if we can't get to your questions, we will get them posted so you can check on that. Where do you check on your application in Show Me Vax? Is this an application for Show Me Vax or an application for the COVID vaccine? That I have to know just a little bit more.
Lena, if you wouldn't mind, could you just quickly explain to folks what that distinction is? I think that might help them.
Okay. Show Me Vax is the immunization registry for Missouri. So that is something totally different than the COVID. We are looking to make sure that we are using our immunization registry to onboard providers as COVID providers. They are actually two separate things. However, we are using Show Me Vax also to track vaccine doses. So, see, from what I remember on the CE for vaccine handling, and correct me if I'm wrong, we can't. Okay, so somebody asked about, from what I remember for vaccine handling, and correct me if I'm wrong, we can use a combination fridge and freezer, but we can only use the refrigerator part, not the freezer. The vaccine storage and handling guide has actually been updated for COVID-19 vaccine, and it was just put out by the CDC earlier in late November. They want standalone units. We used to allow vaccine combination units, but we did those were grandfathered in. Anybody that purchasing a new unit had to have a standalone unit. If we enrolled through the federal COVID-19 vaccination, do we need to register with the state? I will answer that in the next slide. Will there not be a DHS standing order? We need a separate physician contact. We are working on a standing order. At this time, we cannot write an order because we're still waiting for guidelines from our federal partners. And
Lana, this is Jennifer. Can I step in really quick here?
Sure.
So on the standing order, as Lana said, we are working on writing one, and it is Dr. Williams' intention to sign a statewide standing order like he did with the Narcan. So for independent or for pharmacies that have utilized that Narcan standing order, you should have the information needed for Dr. Williams' information for being the physician contact. So that will be forthcoming once Lana has the information needed to write the standing order.
Okay, can we go to the next slide? I think some of it will be answered later on in this presentation, I think.
Absolutely. And someone asked about the slides, and we will have the slides available later, as well as a recording of this webinar. So we'll make that available to everybody that registered today.
Okay. So there is a pharmacy program. This is a federal program. It's into 2 phases. Phase 1 is for long-term care facilities. It's broken into 2 phases. Phase A, which is the skilled nursing facility residents and staff, and Phase B, which is the other long-term residence facilities such as assisted living, residential care facilities, and ICFs. So in Missouri, Walgreens and CVS was chosen by our federal partners. If that was a total program that we were not responsible for. However, out of our phase 1 or phase A skilled nursing facilities, 400 and I think at 498 signed up for this. No other vaccinator is needed because they were teamed with a Walgreens or a CVS or a provider of their choice. That's already been worked out. If you are a pharmacy and you're like, well, I think I can do a phase 1A, be a phase 1A provider, and you are not, and you are in the phase 2 program with the federal program, you would need to register with the state to get vaccine to start vaccinating in phase 1. So phase 2 for the pharmacy program was to increase the pharmacy network for community vaccination. How do you participate earlier? Like I said, that you would have to register with the state of Missouri as a phase 1 provider. Let's see. And you can do both. You can be a phase 1 provider for the for us, and then a phase 2 for the federal partners. Common issues that the pharmacies are facing when signing up. Again, make sure you're completing your prescriber section. That's kicking a lot of people out. Do not leave any section blank. Complete your assets. That's your refrigerator, your freezers, and your digital data loggers. Sign up as early as possible because we will have vaccine available soon. Next slide. Okay, now we can get to questions.
Yeah. So go ahead and make note of that. Obviously there are a lot of questions coming in, and we plan to continue the conversation moving forward on Thursdays at the same time from 3 to 4. Like I said earlier, we will make the slides and recordings available as well. So your colleagues who didn't get to participate live will have that opportunity. And we'll go ahead and move into some of the questions. I apologize. You have to bear with us. This is our first one. And it looks like from what I'm seeing from you guys, you're not seeing the questions that you are populating in the chat. There are tons coming in, and we'll do our best to get through some of them in the few minutes we have left. But then we'll also work to create an FAQ guide for you all based on the questions that we're seeing today. So that's something we'll work on and put out next week. But we'll go ahead and dive into some of these questions that I will ask our panelists to chime in on. So some of the questions that are coming in are related to Dr. Williams and obtaining his information, obtaining a VFC PIN. I don't know who wants to take that one.
So this is Jennifer. I will not be sharing Dr. Williams' information over a call. I will wait to see how he wants to handle that. So I apologize.
Yeah, sure, no worries. And then let's see, gosh, they are coming in quickly. Let's see here. Does the LTCF, the Long-Term Care Facility Partnership with Walgreens and CVS, mean they will be vaccinating the staff and patients at the facilities are independent long-term care pharmacy services?
Okay. And this was run through long-term care. If you're a licensed long-term care agency, you were contacted by our long-term care by the federal partners, they asked each long-term care who they wanted. And they had to indicate on a spreadsheet if they were going to enroll in the program. We did learn yesterday that yes, it will involve, they can vaccinate not only staff or residents, but staff as well. So both will be vaccinated through that program.
And then somebody else asked about the nursing homes, long-term care centers that have been notified about registering to vaccinate. If they don't register, who would be responsible for providing those vaccinations?
Okay, good question. So if you didn't register for the program, we're working to team up and give everyone options. So we should have that finished, I'm thinking pretty soon. So we will let long-term care get that out to everybody. But basically, you could team with another pharmacist in your area or a private physician's office, um, if need be, the local public health agency, or sign up to be a vaccinator yourself.
Someone asked if the freezer you're using has constant monitoring that can be downloadable. Is that sufficient?
Jennifer, and I think it is, but we will check and get that information back to you.
Yes, from what I understood, as long as it continually monitors the temperature and there is an alarm for if it goes out of range, then that was acceptable. Because I know some of the units are tied to the Wi-Fi.
Got it. There are a few questions about who is eligible to be administering the vaccines.
Lana, do you want me to take that one?
Yes.
Okay. So for the statewide standing order that Dr. Williams is planning to sign, it will depend on who he is comfortable listing, because it will be under his license. So I know that we are looking at, and this has not been confirmed yet, so we are looking at physicians, registered nurses, LPNs, possibility for medical assistants and physician's assistants, as well as pharmacists and pharmacy interns. So if a facility has a staff member that is not covered under the standing order, the statewide standing order, and they really want them to be able to vaccinate, as long as they are protected under the license, and that facility would have to write their own standing orders.
Okay, great. And then got a question about the federal pharmacy partner. If we signed up with the federal pharmacy partner, do we also need to sign up for the state's program?
That's going to depend. If you are, say, your Jim's Pharmacy and you're in St. Charles and you want to be and you signed up for the phase 2 federal pharmacy program, and you want to vaccinate in phase 1 that meets our criteria, you have to sign up through the state to be able to vaccinate any earlier than phase 2.
Will PPE and other administration supplies be provided with the vaccine, or is the vaccinator responsible for these?
Both vaccines will be shipped with ancillary kits that provide syringes. The diluent for the Pfizer vaccine will come with their ancillary kits. Each kit, I think, is kitted for 100 vaccine doses to be administered. We also will be shipping out additional supplies through SEMA for vaccination supplies, and I do believe PPE is in the SEMA warehouse for vaccines. And also with your Pfizer vaccine, because since the shipper needs dry ice to recharge the shipper, that the vaccine, if you store it in that shipper, Operation Warp Speed is providing a free one-time dry ice. So when you get the vaccine, you recharge with that dry ice that the Operation Warp Speed got you within 24 hours. They also include PPE for that dry ice recharge.
think another topic that has been commonly asked about in these questions are the pre-positioned sites. And if someone can come on and kind of explain what that means. And I know we're obviously not releasing that list due to security concerns, but I think there's a lot of confusion in the public about what those sites truly mean as part of this plan.
And I will take that if that's okay, Lana.
Go for
so the CDC reached out to every single state and jurisdiction and asked for us to begin planning for at least 5 facilities that have the ability to store in an ultra low freezer. So we worked with the Missouri Hospital Association and their membership to identify those that had the capacity to do so. Based on who responded, we put them in geographical regions that would allow for, or geographical locations that would allow for coverage through the majority of the state. So those individuals will be receiving the vaccine before the ACIP makes their final recommendations. And that would allow for them to vaccinate on day 1. It is just for us to be ready to hit the ground running as soon as we have the approved final recommendations. Those pre-positioned sites have the option to vaccinate their staff, and if they have the staffing capacity to vaccinate surrounding facilities, that is allowable. But with us being able to ship out to other providers within days of the ACIP recommendations being finalized, we're hoping to be able to get vaccine out to people so that redistribution doesn't have to occur. But that was the purpose behind the pre-positioning, so that we would have vaccine in Missouri and in people's, vaccinating people within day 1. So that was the reasoning behind the pre-positioning. And like I said, we did put them spread out geographically.
Jennifer, if I may, I've heard you explain this several times now, and I think when people really understand is when you explain that there's nothing special about these sites after the fact. Everybody has access to the same vaccine pool moving forward. Correct, ma'am?
That is correct. This, again, was just, they are not going to be responsible for getting the vaccine for their region and then distributing it out to others. It was just to have vaccine on the ground on day 1. And then as we get more and more allocation, other providers will be able to order. And depending on the allocation that we have, the longest it could be between when another provider could order would be a week.
Gotcha. And I've heard you explain it like this as well, just as you did in that last sentence. These 10 sites will get vaccines on week 1. And then week 2, as you already showed, there's upwards of 150,000 vaccines available. And those are going to go to a bunch of other vaccinators. And then every other subsequent week, vaccinators, if they are enrolled, will all have access. So there's nothing special about these pre-position sites after this very first order.
Correct.
Awesome.
Thank you for explaining that. Couple questions have come in about pharmacies, enrolling as a pharmacy, and who that position would be, and whether the pharmacist can act as the medical director.
I think you can. If it is our understanding that usually pharmacy, and Josh, jump in here. Doesn't pharmacies usually vaccinate either under the pharmacist or a collaborating partner?
In normal years, it would be under a protocol, but with the standing order that we plan on Dr. Williams signing, we plan to utilize, or a lot of the pharmacies that I've talked to plan to utilize the Dr. Williams protocol or the standing order rather. So we would need to allow pharmacists that are independent pharmacies or whatnot to be the medical director when they're filling out these applications. And I did see another one where I saw, can the CEO and the medical director be the same person? And if they serve the same role, if both of them serve if the same person serves in both roles, then yes, they can be the same person.
Thank you. Another one relating to residents, does the CMO and CEO have to have Missouri addresses? Anyone know that, or is that something?
I would think if they're working in Missouri, we will go ahead and vaccinate them. Does that make sense?
Okay. Mm-hmm. Okay.
And then Lisa,
Lisa,
can I say
wasn't the question around if the provider didn't have a Missouri address?
Correct.
Okay.
So Lena, what will we do? Is that, I mean, I don't know. So it's the provider doesn't have a Missouri address, but I guess it would depend if they have a clinic in Missouri.
Yes, if you have a clinic in Missouri or you're working in Missouri, you would be vaccinated. And then Lisa, for the local public health, if you're on the line, we are having a call, I think Monday. So check your calendars to see if you got that invite.
Great, and we have already hit an hour. Thank y'all for staying with us. I think we could do this for another 4 hours. There are so many questions to get to. So like I said, we'll work on compiling the questions that have come into the chat. And I apologize again that the settings were as such that you couldn't see what was coming in, but we will compile those and work on responding to those and making them available to you. And it'll be later this afternoon that this webinar recording will also be available, as well as the slides that you saw today. So we will also plan on reconvening next Thursday from 3 to 4. Details to come to all of you who registered today. So with that, thank you all very much for your time, engagement, and great questions, and we will talk to you again soon. Thank you.